Hi, I'm Mike Marinick and welcome to this video in my series about scalp psoriasis. In this video you will learn about the many different types of over-the-counter products that are available. I will also discuss prescription products and systemic treatments. There are many treatment options that can help control psoriasis and its symptoms. Unfortunately, sometimes it can remain on the scalp for a long period of time. But don't worry, there are also times when it can actually clear on its own. The most important thing is that you select a scalp treatment that is right for you. You should never choose a treatment that is actually worse than the psoriasis itself. You need to actually consider your style of life. How much time and money do you have to devote to a treatment option? Considering your personal lifestyle should help you to decide among the many options that are available. Let's begin by talking about over-the-counter drug products. These are topical creams, lotions, shampoos, and oils that you can find in your local drugstore. There are many of them, and choosing the right one may be a little confusing. However, these can be highly effective and also may be the most reasonably priced way to go for treating your psoriasis. When considering which product to choose, it is important to note that the FDA currently recognizes and approves two active ingredients to treat psoriasis: salicylic acid and tar. Salicylic acid is a natural exfoliating ingredient. It is relatively gentle, but in high concentrations it may be a little irritating to the scalp. You may already be familiar with salicylic acid. It is often called sal acid and has been widely used at lower concentrations in anti-wrinkle products for years. If you look at the back of an aspirin bottle, you'll also notice that aspirin is made of cetyl salicylic acid. So as you can see, even though the word acid is used in this ingredient's name, it can be an effective yet a gentle and versatile ingredient for many different problems. Tar has been widely used in scalp treatments for years, and you'll find it in many over-the-counter products. Tar also comes in different strengths, and in some strengths may require a doctor's prescription. There are actually two types of tar that are used to treat psoriasis: coal tar and wood tar. Coal tar is the ingredient that is recognized by the FDA. While tar is an effective medication, it can stain bedding and even change the color of gray or white hair. In addition, it has a very strong odor that some people find quite offensive. If you choose to use a tar-based shampoo, you may also want to consider using a non-medicated conditioner after shampooing. This can help to reduce the smell of the tar. There is a third ingredient that you may find in some of these products. This ingredient is called zinc or zinc pyrithicone. Even though some people have found relief using zinc-based products, it is important to note that this ingredient is not recognized by the FDA as a treatment for psoriasis. So how do you choose the right over-the-counter product for you? First, you need to determine the severity of your case. The more severe the case, the stronger the active ingredient may have to be to help with your condition. Remember to read the packaging. The recommended levels of these ingredients by the FDA is 1 to 3% for salicylic acid and 0.5 to 5% for tar. It is always better to start lower and increase concentrations if the medication is not working effectively for you. Never go right for the highest concentration, because this could irritate your scalp and cause the psoriasis to become worse. Tar and sal acid are both designed to help remove the scales from your scalp. In addition to these two ingredients, you need to find a product that includes excellent moisturizing and healing ingredients that will help to reduce the redness and itching. I personally think this is the most important decision you need to make when choosing a product. After all, any company can follow the FDA guidelines and put a certain percentage of these ingredients into any type of cream. But creams, shampoos, oils, and lotions that go beyond the basic essentials and include vitamins, minerals, proteins, and even essential oils and herbal extracts can actually be very effective in treating your scalp psoriasis. Now let's discuss some of the prescription products that are available. Since I'm not a doctor, I'm not going to go into too much detail on these, but I feel it's important to mention these because I also believe they should only be used if extremely necessary. One of the oldest scalp psoriasis prescriptions that's available is anthralin. It's usually applied to the scalp and left in for 30 minutes before shampooing out. Anthralin can stain the skin and cause skin irritation in some people. A prescription drug sold under the brand name Dovanex is actually a prescription topical vitamin D derivative that comes in a solution form. It is applied to the scalp at night, covered with a shower cap, and rinsed out in the morning. It is recommended that this treatment be covered with a shower cap to avoid contact with other skin on the body. It has a tendency to irritate unaffected skin, particularly on the face. There are also times when a doctor may choose to inject certain scalp lesions with a steroid medication. This is only done when the psoriasis is in a few small patches on the scalp. Steroid injections are given sparingly because the medication can be absorbed and may be harmful to your body. Another prescription is called tazarotene. This is a topical vitamin A derivative that comes in a cream or gel form. It's best applied at night and left in as you sleep. This drug may severely dry the skin, and it is recommended that you apply moisturizers 30 minutes prior to using the tazarotene. In the most severe cases of psoriasis, a doctor may choose to use a systemic treatment for your psoriasis. This is usually a last resort and usually involves an oral medication in addition to topical injections. Systemic psoriasis medications can have very serious side effects, and these must be considered in relationship to the benefits of the treatment. In addition to skin irritation, mild hair loss can also occur with these types of treatments. I realize that this video contained a lot of information and may be a bit overwhelming for you. However, in my next video, I'll tell you about the treatment option that is working for over 80% of the people that try it for scalp and body psoriasis. It's simple and easy to use, and I'm quite sure you're going to want to hear about this. So please take the time to watch my next video. I'm Mike Marinick, and thanks for stopping by.